Okay, well,
So
I
it's
guess,
Henry,
Secretary.
secretary.
Runs downhill, right?
yes, are you deputy?
Secretary. I'm
She's the
secretary.
secretary.
Okay.
So it'd be
Is
Jason.
it Mark that's vice?
Mark
Yeah.
is vice.
Yep.
Jason.
Thank you.
Jason is
No problem.
chair. Okay, so Henry
Okay.
used to run it,
So
which
just
you're
say-
familiar with, right?
The Board of Health meeting. And then-
Fantastic. So why don't we call to order the June 9th, 2025 Board of Health meeting at 7:33 p.m. Hopefully everyone had a chance to take a peek at the minutes from the last meeting, May 12th. I perused them. I didn't see any corrections or edits. I don't know, did anyone else have a chance to take a look or any comments, edits, questions, concerns about the minutes? Great. Hearing none, if I can get a motion to approve the meeting minutes from the May 12th meeting.
Motion to approve. It's Sally.
Thank you. Second?
I'll second.
Thank you. Any opposed? Any abstentions? Great. Hearing none, the meeting minutes have been approved. We'll move to our next agenda item, which is the reports. Our Director of Health report. Sam?
Sure. Yeah, so just the last month, we've had spent a fair amount of time sort of focused internally with the entire town has switched to a new time and attendance system called Paycom. And so that's, taken a fair amount of every staff in the health department's time to sort of get on board with that and learning how to plug your time in the right way. And for supervisors, sort of who approves who and looking to, it just really rolled out like last week. And this is the first week where we're kind of approving things. So it's very, and understandably so, lots of people are making mistakes and come on in. And we are working to, learn the system as we go. And so a lot of time focused on that. We continue to meet weekly on our transition to the Municity database, which will be our, permitting and licensing database. We currently use it just to approve building permits, but they're really pushing IT is really pushing to get us up to speed on, the company to do the work that's needed to help us roll that out. So we'll have licensing permits, complaints, blight, unfit structures, basically all of environmental health will be in the new system. So we're trying to roll that out. We think, we'll start using some portions of it over the summer, and then hopefully our big licensing time is January through May. We do restaurants and cosmetology and pools and hotels and motels in September, but we'll, we're shooting for to go, do our licensing next January through that. We'll see. They said 2 years ago that it should be a few months, so we'll see. And so we're working on that.
I'm sorry, just a quick question.
Sure.
Will there be a public interface or public access to that data as well?
Yeah, so right now, like the town is using the system. So if you take a building permit out now, it's all online now. So you go online, you upload your plans, everything's done that way through zoning, through conservation, through building, and they're trying to get that for us. We're a little different in the sense that, while they issue building permits, our licenses are a little different. So it's like building permits don't renew every year. So something as simple as that is a difference. The company is since the time that we, all the town departments got together and selected this company, and then since the company's been sold to another entity, which put the brakes on a lot of things, and a whole new pay structure came into place of, if you want to talk to us, you have to pay for it, or if you want any kind of change, and so, which was different than what sort of how we perceived it earlier on. So anyway, so we spend a fair amount of time focusing inward on those two issues. But we have been doing a bit of health promotion efforts with promoting lots of social media posts. And we have Emma and Santina work together on the social media posts that hopefully come across clever and informative. We've got tick awareness, we've got mosquito prevention awareness, sun protection awareness, safe swimming, drowning prevention, all posts that are timely for this time of year, trying to get people to pay attention to that. We launched a couple of our mosquito prevention ones, which was "Are You a Good Tipper?" is the title. And so it's about tipping over things in your yard, getting rid of the water. We had "It's Time to Tip or Treat" with a Halloween-themed ad. And so getting people to tip over things, water-containing items in the yard. And then one was "Don't let rain showers give mosquitoes power to ruin your summer's hours." So that was one of our ones that we felt we liked that one. And by we, it's mostly me, We continue our work with the Safe Streets Alliance, Fairfield Safe Streets Alliance, which we will be doing a big launch. I believe it's on the 23rd. Make sure that's correct in the notes, in the minutes. I think it's the 23rd. It just got rescheduled from the 17th. And actually the governor's coming down to help promote that. And basically, for Nina's sake, it's I don't know if you're aware of it, but selectmen wanted to put out a campaign about street safety and getting people to slow down and obey that everybody who uses the roads to obey the rules of the road and to think about being safer on the road. And so all the behaviors that are related to that, we're going to have a series of social media posts over the summer. We're having people sign a pledge where they get a yard sign and a car magnet or a window cling that says, "I signed the pledge, road safety starts with me." And it's really, aimed at changing behavior for people on the road, and to get people to think about it and slow their speed, less distractions, all those kinds of things, as well as for those who use scooters, electric bikes, and walkers, and everybody to be aware, of all the things you should be doing to keep yourself and others safe. And so, so we continue to work on that. That's a weekly meeting for Santina and myself. And as far as respiratory virus disease, everything's very low right now. Everything's is basically back to background levels, almost, continuing to come down. The measles is, it's kind of leveling out. There's no significant increases. We did see a slight spike in cases in mid-May, but it's been kind of coming down, going up, coming down, going up over the past few months. H5N1 is staying the same. We're still at 70 human cases, 1 death. That hasn't changed since the last month.
Those are national.
Those are national, yeah. And so, not 70 in Fairfield. So we can continue to keep an eye on those and essentially preparing for, potential measles cases. States around us have all had cases, so it's really a matter of time, whether it's a travel-associated case or someone associated with some of these outbreaks that are going on. There's some 17 outbreaks going on throughout the country, mostly tied to the, Texas and New Mexico larger clusters. This past weekend, and you may have seen it on the news, there was a spike in overdoses and overdose deaths that was seen, within the last week. And so they put out a notice on Saturday making people aware of that, providing some harm reduction guidance. While it's being seen sort of on the I-95, 991 corridors, it's largely focused in New Haven and Hartford, but a few cases around this area. And so we finalized tonight a post for that, just taking some of the guidance from the state and creating our own post on that and getting it out there, and to work with the hub to make sure there's Narcan access for those who need it and want it. And so regarding our federal grants, so there, I think I shared before that we got these sort of 2-time extensions up until April 29th. And recently the state shared that the court case that Connecticut's a part of, 21 states, including Connecticut, are part of, was at least initially ruled in favor of the states. And so the spigot, if you will, is flowing again. And so we can submit expenditures on those 2 grants. And so we've already fully expended the ELC2 grant, which was a sort of legacy COVID grant that they kind of repurposed, and then the immunization grant, which ends this the end of this month. So we were able to we kept expending, and we got approval to use other funds to keep those staff on, and so we continue to expend, but now we can take those funds and build back to the grant. So we'll leave some money on the table there just because the award was late. We hired staff later in the grant, and then the staff switched to another position within the health department when the grant funding was threatened to be suspended. So we have some unexpended funds there that we'll leave on the table for that one. We continue to work on our community health improvement plan with the Health Improvement Alliance. We hope to have that finalized by early September, and then we'll take that information and we'll come to the board with the initial steps of doing a new strategic plan, and we'll sort of work on that with the board and departmental staff to sort of schedule out a new strategic plan for the next several years. So we'll probably bring on a consultant to assist us with that.
As last time we did that was two years ago?
It's usually every 3 years.
We had rolled out one just before COVID, and so what we had done is we had extended it. Basically, it was a 5-year plan, and then the hospitals do the 3 years.
Oh, yeah.
We made it a 5-year plan, and then we extended it to 25.
Okay.
And so it's wrapping up now, and so we'll at some point come and do a report to the board about here's where we were, and these are things that we're going to continue on, hopefully in the next strategic plan. And but you'll see in the last several strategic plan, transition to new database, like still there, of things that have taken a long time.
Right.
And so we'll keep working on that. We'll have the strategic plan rolling out. The state did an update to what's called Web EOC, Emergency Operations Center, so it's our communication system with the state. Did a new sort of refresh of that, rollout of that, and so the staff is having to participate in Web EOC trainings. I went to the first one of just sort of refreshing of here's what's different, and but it's the state's requiring it for us to maintain access to it, and so we're having the staff go through that. We did find out at Friday's Connecticut Association of Directors of Health meeting that our per capita grant in the governor's budget, the first year, the 2-year budget for the state, the first year we're getting a 10% reduction, and then the second year it'll be a 20 cents per capita increase. So in the end, it's somewhat of a wash. We did see a bump during COVID and since COVID, and so it's kind of it's reducing us back to even where I think we were ahead still with the 10% reduction, ahead of where we were pre-COVID. And in the second year, they said there's no guarantees about the second year, but that's what it's on paper is that they plan a 20-cent increase for municipal health departments, 40-cent increase for health districts. So we're, it's a wash. We'll take the hit this year. It shouldn't impact us this much because we have some carry forward. So the per capita grant, they let you carry forward unexpended funds to the next year. So we have some carry forward. So we should be fine in maintaining staffing levels and everything. We're working to promoting the Mission of Mercy free dental clinics coming up on June 20th and 21st on our social media. I think we talked about at the last meeting the In a Heartbeat cardiac screening that we're doing at the two high schools. We ended up with 469 individuals getting screening, so it's a really good number. The group that organizes the screenings was very happy with that, the foundation that brings all the equipment, and we did have 9 Medical Reserve Corps volunteers participate in that, as well as community emergency response team members. And Santina is working with Senior Center to do monthly health talks, and they rolled out, they kind of started working on this this spring, and they had their first one at the end of May, where it was they had and I'm not sure what type of physician it was, but I talk about osteoporosis and fall prevention and exercises that people can do to avoid falls, which Santina already does that through our Matter of Balance program, but it was really well attended, and Santina felt the content was excellent and very well received, and so we'll continue on in the fall with this monthly series of health talks that it's focusing on senior type of issues in collaboration with the Senior Center. And that is all I have for this.
Great. Thank you. Any questions for Sands? Either in the room or online?
Hi, it's Sally. I actually do have one question. I know we keep bringing up things about the safe roads every time you talk about it, like before the scooters, but the other thing that I'm really curious how much all of the different departments talk to one another. So obviously there's been a lot of buzz online and just in the town about all of the developments that have gone on in Fairfield, how there's been so much increased building, increased traffic. And, honestly, one of the ways to create much safer roads would also be to limit some of the overbuilding, especially in areas that just don't, have the infrastructure to support it. So I'm just kind of curious about if there have been some good, conversations with, the planning and zoning committees where they could be taking that into consideration because it would impact these other programs happening in the town.
Yeah, so how it works here in town with any large project is the project is submitted to planning and zoning. Planning and zoning has their process of going to the, their boards and public approval and public hearings, but internally we have what's called a code review meeting where every department meets and provides comments on the plan and suggestions and issues where they see things are out of compliance. But with any of those plans, especially those larger ones, there's always traffic studies involved in terms of determining the impact on traffic, but also in the plan of conservation and development and the, now I'm drawing a blank on it, the Bike and Pedestrian Committee worked on getting a master plan for development to consider pedestrian improvements. And so there's a whole guidance document that gets reviewed with these large projects to make sure they're taking into consideration, making improvements to sidewalks, crosswalks, limiting the impact on traffic by things such as, when you pull out of this development, you can only make a right-hand turn. You can't go left, and those types of things. And even things like, and this is something that engineering is working on continually. So, of means of slowing traffic, they did the Reading Road Traffic Circle. They're doing work on Villa Ave, all measures of, slowing traffic and improving pedestrian safety. And so it's something that engineering is already doing, but in terms of working collaboratively, the departments within the town do get an opportunity to comment on all these plans and, clarify things. And, in terms of the Fairfield Safe Streets Alliance, it's comprised of folks from the First Selectman's Office, Health Department, Fire Department, Police Department, Engineering, the library, and folks coming together to, we're more about, this particular campaign, but we, we periodically have larger meetings with staff from engineering providing comments on projects they're doing. The Bike Pedestrian Committee is a part of the Fairfield Safe Streets Alliance. So there is a fair amount of interdepartmental and not just inside the town, but also the community groups that are sort of leading this effort are at the table as well.
Thanks, Hans. Do you have, just along those lines of what Ms. Conley's commenting on, so is there a way if the public or board members, the Board of Health members have any suggestions or comments, what would you recommend is the best way to reach out to planning and zoning or?
Regarding what,
Yeah.
what kind of comments do you have in mind?
Well, I guess if someone had either questions or concerns about taking traffic patterns or suggestions that the public might have into account.
There's a community survey that's on the town's website.
Yep.
It's still open, right?
I think they might have extended it, but it's about to close soon.
It's about to close. But I know a lot of people have been submitting. I filled one out.
Okay.
Yeah, we were up around 2,000
shared.
people
Yeah.
submitted surveys.
I think it's a really top of mind issue for
Yeah.
everybody. I think everybody notices it, so.
Great, so
Yeah, but-
there are opportunities and
But comments like that can come in, engineering, to the First Selectman's Office.
Right.
They want to hear about these things. If there's specific areas where they feel like there's room for improvement. But again, every time there's any kind of construction activity, whether permitted by an outside entity or the state or the town generating that, it's always a consideration of how can we design this, improve this to make it safer for everybody who uses the roads. And so that's sort of the theme. I mean, we've been, I don't think you were on the board in 2014, but we actually brought in someone with an urban planning background to give us a talk at the Fairfield Theater Company. And, the town and the health department is working on this issue for, more than 10 years now, trying to promote safer streets and, and getting people, because if you make the streets safer, people will use them and people will walk and people will bike and they'll feel safe letting their kids, ride their bikes to school. We're not there yet in every area, but we're working on it.
work in progress.
Yeah, it's Sally. Sorry, it's Sally again. I'm just, to me, it's just like frustrating because I know that's just government sometimes and all of the different layers of bureaucracy, but it's just like, if you were to just look at it very globally at something that would make safer streets would be to decrease or at least try to even out this, the density, and we're doing the complete opposite. So it's just like one of those kind of common sense things. And then it seems like there could be more, interaction and discussion, or even just like a stronger proposal that's just put forward to planning and zoning to kind of decrease like the excess of approvals that have been occurring. So that's just my 2 cents. It just doesn't really make sense to me, and that's just the way it is.
Yeah. In regard to that,
it seems like it's stupid because we are making our roads so much busier and so much more congested, and then we're doing this like safe street campaign. It just, it's a little bit of lip service, I think, but that's my perspective.
And Sally, just to follow up on that, the town of Fairfield did a significant amount of work in obtaining a moratorium for the next several years on any new development. But as you're likely aware, there's this 830G statute that allows for, if you meet certain criteria, a developer is allowed to, regardless of zoning's findings or opinion, is allowed to develop. And it's a reaction to this, the not in my backyard type of, nobody wants these larger developments necessarily near their neighborhood. And so the state passed these laws to make affordable housing more available. And the way they're doing it is, that these developments have a certain amount of affordable housing in it. And once they meet that criteria, they can build it. And so we have this moratorium now that's going in place, but everybody who was in the pipeline prior to the moratorium going in place, everybody who has approval or was on the agenda of zoning has the right to continue with that process.
Right.
To get their approval.
Yeah, but other towns have been more effective in blocking it, whether it's like via lawsuits or just via being more outspoken. They've stopped some of the proposals that have attempted to go forward prior to the moratorium. And we all know it's just a small percentage of every, the 10% of every building. So, 90% is just increasing the density. So, we could be doing more as a town between all the different departments. I just think we should be trying harder. And as someone who's on the Board of Health, I feel like I just don't, we don't have a lot of voice. It's more just kind of reflecting on things. And so that is something that I do feel strongly about, that we could be doing a better job. And it just kind of came up in this context of the Safe Street thing, because it does seem ironic, but I'll let go of it right now because I'm not going to change that, but I just wanted to kind of have that opinion on the record. Okie doke.
Thank you.
All
Thanks.
right. Thank you. Great. We'll move on to our Assistant Director of Health report. Rob?
Sure. As the seasons change, the environmental program has different things that we're working on. We started water sampling for all the beaches in Lake Mohegan on May 19th. We have an intern, Connor Monroe, who's been doing it for us. He's been coming in on Mondays. The pickup again is in Fairfield on Monday for many local health departments, or several, I should say, in health districts. Luckily, we haven't had to close the beaches at all yet, despite we've had rain, but it hasn't been a substantial amount of rain within the criteria, so that is a good thing. We've also started our, with spring and summer, it starts off the temporary events. You guys probably saw the farmers markets and everything, so the sanitarians have been out a lot the last couple of weekends doing the inspections for pop-up markets, Fairfield U, Reunion, different things. Myself, Melissa, Debrina, and Santina all worked yesterday at the farmers market on the green. It was the first day, so we'll be doing that, if not weekly, bi-weekly. The market has gotten larger and larger every year, and it continues to get larger. So we're working with Park and Rec on that, so we'll be busy with that. Another thing that we've seen, we're always doing tick submissions for us to analyze to see if they're deer ticks to be sent up. And there has been an increase, and Andrea's actually done a good job of keeping the numbers. We've seen a 45% increase of tick submissions from last year's total. We went from 63 to 96, I think the number was. So we actually noticed that it's gone up substantially, probably because of the weather conditions and so forth. But we continue to do that and have them submitted to the state if they are deer ticks. The environmental staff over the last couple of months, in June or May actually, we had to do the lead inspector risk assessor training that's required once a year. So all of us did that, and we all passed, which is a good thing. We're required to do that once a year. Allison was going to have a meeting with the coalition that started about 6 months back, but it was canceled the last two times that we had it for Allison.
from social services.
Social services
Yeah,
for
social
hoarding
services.
complaints and identifying different things, but she had to cancel it the last couple of months, but we will be meeting over the next, at first she thought it was quarterly, and then she switched it, because I think a lot of people on that coalition wanted to meet monthly to make sure that we had training. Around this time of the year, you don't start to see a lot of hoarding complaints. It's more in the winter months and things such as that. So we're going to start meeting monthly, starting back up this month. Another thing that we've always talked about on the environmental side is always overcrowding. And just to give like an overview of how it goes, mainly down at the beach, we do have a hearing with the Public Health Commissioner from an appeal from a landlord down on Fairfield Beach Road, and that hearing is Wednesday.
They withdrew their appeal.
I just found out they withdrew their appeal. So, but it gives you an idea of how long it takes. This started back in,
A few months ago.
yeah, a while back. So by the time it goes through the process, students are moved out, the landlord withdraws their appeal, and then they either comply, otherwise it starts all over again. So it's kind of finding an uphill battle, but we continue to do that down there. But I just wanted to give everyone an idea of what the time frame of these complaints are. Besides that, that's pretty much my report.
Do you all get a report back from the TIC submissions about what the results were?
Yep.
Yeah, keep track of that.
And locations?
Yes, we have that, yeah. We don't, we generally don't post it or, we don't want to, because it could be considered protected information, but we do periodically put out reports of, how many ticks are coming back positive, yeah. But
The question about the overcrowding at the beach, it's cyclical, right? I mean, things should quiet down because the students are out, is that right?
Yeah.
And then we pick up again in the fall.
Yeah, like for instance, like I'm working on one that we sent an order back, and it's across town, but down at the beach, yeah, it'll start up. You'll start getting complaints as soon as they move in. They'll quiet down, and then you get more complaints. And then once school's over with, you don't get any complaints.
And we really worked with the associations down there, the Peninsula Association, Fairfield Beach Area Residents Association, and we meet with them regularly. We meet with them in August every year. We meet with them a few times throughout the year, along with the university, and, we always stress with them, if you think it's happening, let us know early in the school year, because if you wait till December or, when they move back in January, it's too late, in terms of the process of enforcement and eviction, it's just too late. So we need to get the complaints in early, and we need to, for the housing prosecutors to take the case seriously, we have to have evidence to support the claim that it's overcrowded, and that takes a while to gather. So.
Great. Shifting gears, just another question about food trucks.
Yeah.
So, with the warmer weather, it's that time of the season. I know we do inspections on food trucks. I was just wondering, how about food trucks that go to individual homes?
So if they go to individual homes, they don't have to be licensed.
They don't.
to us,
Okay.
because I guess the way you can see it, it's like ordering a pizza in a separate town and they deliver it.
Okay.
So that's the way it's handled.
So the consumer should be aware of and ask the vendor, are you licensed? And when people call us, that's what we advise them. It's like, they have to be licensed. It's like hiring a caterer to do your party at your house, which is that's really what it is. They happen to have a truck, but they're catering an event at a house, at a private house. It's not for retail sale to the general public. And so we don't really get involved in that. And there's this reciprocity agreement now with vending trucks that if you're licensed in one town, and it's supposed to be towns that sign on to a memorandum of understanding, that if you're licensed in one town, the other towns that sign the MOU will honor that license in their town. So we don't necessarily have to license all the vehicles, and we are a part of that agreement and, are supportive of it. It's, we always retain the right to inspect them, and everybody who comes into town gets an inspection, regardless of where they're licensed. If we license them, someone else licensed them. But there's that new caveat within the last year or two where it's like, okay, if they have a license anywhere, you know, we're gonna honor it, you know.
I was just wondering, we had a neighbor who had, and, you know, it's the same issue that I have when I go to restaurants. Every time I start staring into a kitchen, my wife is just like, stop looking, stop, just stop.
Yeah.
Like, okay, so I happened to be at a food truck, and I started looking, and my wife said, stop, just stop. Okay. I'm like, all right. Good to know, thank you.
Yes, we all suffer from that.
Yeah. I was told long ago that if you follow the director of health into a restaurant, and you know you're gonna be okay.
All right, fantastic. Any questions, in the room or online?
I did have a question.
Yes.
What is the messaging? So
I'm sorry, who are you?
Oh, sorry. My name's Kelly. I'm an RN. I'm a registered nurse in the town of Fairfield, and I'm also a nurse practitioner student at Fairfield University.
Thank you.
And I did have a question around the messaging that the town is putting out for the public when they do submit a tick to be tested. Is the messaging that if the results come back positive for a tick-borne illness, follow up with your physician, or? Okay.
Anyone that comes in with a tick, if we identify it as a deer tick,
Right,
the first thing that we say to them is call your physician.
okay.
You know, if you start getting anything flu-like symptoms, you see a bullseye, call immediately.
Right, and then is the messaging just any tick that's found embedded should be sent out?
No, so the state of Connecticut will only test deer ticks.
Okay, but essentially any deer tick that's found, the recommendation is to be submitted and
It
sent
has
out.
to, the way the state does it, some people bring ticks in that are just ripped apart. They're not gonna take those, and it has to be engorged. So they have to have something to test. So,
Okay.
yeah, so we'll send them up, and then they'll send us back the results, and we'll contact them too. And then, but
Okay.
we always tell them right off the beginning when they come in, you know, contact your physician.
And we'll typically lean towards, if it's unclear if it's engorged,
Yeah.
we'll lean towards just send it out.
It's
Yeah.
$5 to send it up, so we say just send it up. At the
Yeah,
end
I
of the day,
was
just
just
say
curious,
they
because
can't test.
from a healthcare provider perspective, a lot of times when patients test positive, when the ticks test positive, it's not always reciprocated by a positive Lyme test, and so it can elicit a lot of fear, essentially, like all the testing of the ticks.
Yeah.
But again, it's important, so I was just wondering.
Yeah, and it's ultimately, you know, as we say to them, ultimately the decision between you and your medical
Yeah.
provider. It's not a health department decision.
Right.
And as we get further into the season, or probably already in the season, by the time you get that result back, you have had to have made a decision regarding treatment already.
Absolutely, yeah.
You know, and so we just, you know, it's you know, but we always lean towards, just send it up. If worst case, they tell you it's a deer tick and it's not engorged.
Right, okay.
You know,
Thank you,
or,
that
you know,
helps.
yeah. Sure. Any other?
Thank you. Fantastic. All right, well, thank you, Rob. Appreciate it. Any communications, Sam?
No communications?
All right, any old business?
We have no old business.
Any new business?
We have no news business unless we have some guests here who have questions for us that want to ask anything? No? Okay. Can you just share where you're from?
I'm Brittany. I'm also a nurse practitioner student at Pearson.
Great.
I'm Lydia, also a nurse practitioner student.
Great.
We're all nurses.
Welcome.
Awesome.
Yeah.
Thank you.
You've been in a class with Eileen Benoit?
Yeah.
Yes.
Oh, fantastic.
Yes. We love Dr. Boyd.
Yes, I work with her, as you know, she works down at Stanford.
Yeah.
Works down at Stanford. Fantastic. Small world. All right, fantastic. Well, if there's no other new business and no other new questions, can I get a motion to adjourn?
Motion.
Thank you. Second? Second. All right, any opposed or abstentions? Hearing none, we'll adjourn the meeting at 8:12. All right, thank you, everyone.
Thank you.
Thank you for coming.
Thank you, everyone.